Our I-team investigating the pain pendulum, how the war on opioids is hurting Chicagoans who are dealing with excruciating pain. Investigative reporter Chuck Gowdy here with details tonight.
Alan, while the country works on laws and enforcement to prevent opioid overdose deaths, those who legitimately need pain relief say they are being victimized by a pendulum that has swung away from helping people in pain. There's no disputing an opioid crisis is causing thousands of deaths across our communities each year. But tonight, some patients and physicians are saying the pain pendulum is going too far.
I wanted to take my life. I couldn't take it any longer. It was so horrible.
Maria Pollock describing her gut-wrenching despair from uncontrolled pain.
Did you take the needle out of the port?
She suffers from a connective tissue disorder and says she is genetically resistant to many pain medications. Pollock says the opioid drug that worked for her has been taken off the market due to abuse concerns. Now she's having trouble finding reliable treatment.
We try to live without opiates as long as we can. Sometimes there is no other way. It's unavoidable.
Full name again?
Annette Delgado battles crippling pain attacks brought on by sickle cell disease. The long-acting morphine that keeps her functioning, she says, is now being denied by insurance.
What happens if they stop covering all of our meds? Then what's going to happen to us?
Sufferers of chronic pain telling the I-team the national crackdown on opioids has them being flagged as if they are criminal drug addicts. Doctors, they claim, are abandoning them because of increased scrutiny, and they say they're being denied coverage for the drugs they've used responsibly for years.
It may be the only actual thing that works for them.
This pain patient advocate says the alarming stories of desperation pour into her website daily.
We're at risk of making people pay the price for the crimes of other people.
Opioids such as morphine and oxycodone are used to treat pain that may not respond to other medications.
For sickle cell disease, I can say that the pain crisis that needs treatment needs medications like opioids.
Drug abuse experts say these pills have flowed too freely to the wrong kind of patient, helping fuel the drug epidemic. And some physicians say opioids shouldn't be prescribed at all. As they try to rebalance prescribing practices, doctors are also facing a dangerous backlash.
Confrontation, we believe, is going to be over pain medication.
In northern Indiana, police say the enraged husband of a woman seeking back pain relief shot Dr. Todd Graham, a Northwestern medicine grad, twice in the head because he wouldn't prescribe opioid pain relief. The shooter, authorities say, then took his own life.
A tragedy is such an understatement of what happened.
The pendulum is swinging as federal agencies, lawmakers, even corner drugstores are putting guidelines and restrictions in place. A new analysis showing 24 state governments taking action, most of the legislation limiting first-time prescriptions to 7 days. Some states are also setting dosage limits. As of right now, Illinois has no mandated restrictions. The State Medical Society telling the I-team it will aggressively lobby against them.
We cannot treat a patient with legislation. We treat a patient with our own knowledge, with our own personal contact with them.
But some doctors tell us they can't prescribe safer alternative pain therapies.
Oftentimes we're handcuffed because it's not a generic medication.
Chicago spine surgeon Kern Singh helped create an alternative approach to treating surgical pain. He says many insurers won't cover.
The only way we can control narcotics and pain control at the same time is by allowing us access to other medications that are more expensive but are best for the patient.
Desperate chronic pain patients wonder what they will have to resort to if they're left with no options.
Last week alone, I was here in the pain clinic 4 times because I don't have the medication that I need.
A spokesperson for the health insurance industry tonight says providers are working on a better path to healing without putting patient lives in danger because of opioids. Legislation now awaiting Governor Rauner's signature would require that doctors check Illinois' patient database before prescribing opioids to see if they are gaming the system by getting pain meds from multiple doctors. This is such a problem for so many people.
You can appreciate the distress those patients are under.
Certainly can.
All right.